on this day, the 21st September 2023, I hereby announce that we are declaring dementia as a public health priority. ಇವತ್ತು ನಿಮ್ಹ್ಯಾನ್ಸ್ ಸಂಸ್ಥೆಯ ಜೊತೆಯಲ್ಲಿ ಹಾಗೂ ಡಿಮೆನ್ಷಿಯಾ ಇಂಡಿಯಾ ಅಲಯನ್ಸ್ ಮತ್ತು ವಿವಿಧ ಬೇರೆ ಬೇರೆ ಸಂಘಟನೆಗಳ ಜೊತೆಯಲ್ಲಿ ರಾಜ್ಯ ಸರ್ಕಾರ ಈ ಡಿಮೆನ್ಷಿಯಾ ಬಗ್ಗೆ ಹೆಚ್ಚು ಅರಿವು ಜಾಗೃತಿಯನ್ನು ಮೂಡಿಸ್ತಕ್ಕಂಥದ್ದಕ್ಕೆ ಈ ಒಂದು ಡಿಮೆನ್ಷಿಯಾ ಸಾರ್ವಜನಿಕ ಆರೋಗ್ಯ ಆದ್ಯತೆ ಅಂತ ಒಂದು ಘೋಷಣೆಯನ್ನು ಮಾಡುವಂಥ ಕಾರ್ಯಕ್ರಮ ಇವತ್ತು ನಾವು ನಿಮ್ಹ್ಯಾನ್ಸ್ ಸಂಸ್ಥೆ ಇಟ್ಕೊಂಡಿದ್ದೇವೆ. ಇದರ ಮುಖಾಂತರ ಡಿಮೆನ್ಷಿಯಾ ಬಗ್ಗೆ ಇಡೀ ನಮ್ಮ ಸರ್ಕಾರದ ಆರೋಗ್ಯ ವ್ಯವಸ್ಥೆಯಲ್ಲಿ ಆರೋಗ್ಯ ಇಲಾಖೆಯ ಎಲ್ಲ ಕಡೆ ಇದರ ಬಗ್ಗೆ ನಮ್ಮ ಯಾರು ಹೆಲ್ತ್ ಪ್ರೊಫೆಷನಲ್ಸ್ ಇರ್ತಾರೆ ಅವರಿಗೆ ಮತ್ತು ನಮ್ಮ ಪ್ರಾಥಮಿಕ ಕೇಂದ್ರ ತಾಲೂಕು ಕೇಂದ್ರ ಎಲ್ಲ ಕಡೆ ಇದರ ಬಗ್ಗೆ ಗಮನವನ್ನು ಹಾರೈಸಬೇಕು ಅಂತ ಮತ್ತು ಇದು ವಿಶೇಷವಾದಂಥ ಒಂದು ಆರೈಕೆಯನ್ನು ನೀಡ್ತಕ್ಕಂಥದ್ದಕ್ಕೆ ನಮ್ಮ ಒಂದು ಆರೋಗ್ಯ ತಜ್ಞರೇನಿದ್ದಾರೆ ಮತ್ತು ವೃತ್ತಿಪರರಿದ್ದಾರೆ ಅವ್ರಿಗೆ ಇದರಲ್ಲಿ ಹೆಚ್ಚು ಇನ್ವಾಲ್ವ್ ಆಗಬೇಕು ಅಂತ ನಮ್ಮ ಉದ್ದೇಶ. ಅದರಿಂದ ನಿಮ್ಹ್ಯಾನ್ಸು ಮತ್ತು ಡಿಮೆನ್ಷಿಯಾ ಅಲಯನ್ಸ್ ಇಂಡಿಯಾ ಅಲಯನ್ಸ್ ಏನಿದೆ ಇವರ ಸಹಯೋಗದೊಂದಿಗೆ ನಾವು ಇದನ್ನು ಅಧಿಕೃತವಾಗಿ ಇದನ್ನು ನಾವು ಇವತ್ತು ಘೋಷಣೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ.
About 7.4% of people who are in the older age group suffer from dementia in this country. Only about 5% of them are diagnosed and fewer people get treatment. On September 21st each year, we commemorate World Alzheimer's Day, which is very important to spread awareness about dementia, what causes it, how can one prevent dementia, how can one diagnose it early, and how can one make sure that the continuum of care is available to people. So I think it's very important to recognize that dementia is a public health priority in our country. As people grow older, the risk to dementia is also higher. There are many preventable causes which can reduce the onset and the complexities of dementia. That includes control of hypertension, diabetes, other non-communicable diseases, stress and so on. It's also very important to understand that many other conditions, including mental illnesses, can cause cognitive decline, and therefore it's very important that all people above the age of 60 are evaluated for cognitive changes, and people with other chronic diseases are also evaluated for associated cognitive decline. In addition, we need to have standardized tools which will pick up the disorder. We need to train people in the community, like our community healthcare workers and our ASHAs, to identify cases with probable dementia. The whole idea is to try and double the diagnosis of dementia, and the earlier we catch them, the better can be the remediation, the correction of underlying risk factors. The principles of treatment in dementia are to make sure that we do not allow the loss of further function, and that is by control of diabetes, hypertension and other illnesses. The second is to make sure the person does not have any further deterioration of function, and the third is to compensate for the lost function. It's wonderful that we've had here today several people and several institutions which have come together to observe Alzheimer's Day, and that includes, apart from the National Institute of Mental Health and Neurosciences, which has a very large multidisciplinary team addressing concerns of the elderly, including dementia, the Dementia Consortium of India, the state government, which has taken a lot of initiatives in the area of health. We hope that in conjunction with the Dementia Alliance as well as the state government, we'll be able to increase awareness about dementia, improve, train human resources who can both diagnose as well as treat these disorders, and of course make sure that carers are supported in every way possible to provide care and dignity to people who are older and have dementia.
About the needs. Why is it necessary to have this? Now, going to my personal one, because I have seen this personally. From 1996, I have been doing these home health services through Nightingale's home health services. And I was able to interact with not only the patients but also with the families. To tell you that I have seen nearly about 30,000 families in the past 20 years. This gives me a great insight into what's really happening. I mean, it is not book things, but I have seen so many of them. And I have seen what is the need. In the beginning of my service, I could see just a few, one or two, that's all I could pick up. But as the years went by, I could see the numbers increase, the awareness, maybe because of the awareness and also the amount of stress that the family was going on. Now when I interacted with them, I found that it was not only the patient. Let me tell you, it is not only the persons who are suffering with dementia, but it is also the families who are surrounding that, who face this. I think there are many of the caregivers here who know about this, because they really do not know how it is. I've seen play in many of the houses. There's a great strained relationship also between the husband and wife because a person with dementia, because they get neither time to go out or spend time with themselves. There is so much of thing in the family. You also can see the inability to look after them. There's a smaller room, person is wandering, they do not know how to take care. There are not enough services. And where are the other things to ask for? There's no information, there is no awareness. Also a stigma attached to the whole thing. Keeping all this in mind, I really felt that though, I mean in a smaller way which I am talking about, because understanding this sort of dementia, we have been working since a long time in this area. I can compare to what is really prevalent. As a person who is in close touch, we felt we could do something toward this, because once you are diagnosed, what is next? Are we going to just leave them alone there? Is there going to be a continuum of care? Or is there going to be some sort of a place where they could get some? That's how we started some 3 daycare centers and 3 residential care centers. Now, I think that the inauguration of one of our centers, the biggest center, the Nightingale's Aging and Alzheimer's Center, was our health minister was part of it. So I hope you remember that. So from that 2010, I have even closely seen people with dementia, because we have a 100-bedded facility. People come in, and I have seen with my own eyes how much struggle the person who comes along with it. I go on stressing about families, because I know persons suffer. I understand the patient suffers, but equally the the families suffer. We have to find an answer for this. How do we find an answer? And you all know that it is irreversible, it is chronic, and people are very much dependent on everybody. So take care is very, very important. And after this, I also feel, how do we fill up the gap? It's a very difficult question, because all of us have to come together. It is not one person who comes together. We have to think about various people to come together to solve this problem. One is, now coming to what is the at present what is happening. You have to see that today there are about 88 lakhs of people, that is about 7.5% of people have dementia. And now it is just not 88 lakhs, it is along with it 88 lakh families who are with us. And Karnataka, sir, it is about 7.6. It's a little higher than the normal thing. So it's about 7.6 which is having dementia. And by 2036, now when it is 88 lakhs, by 2036 it will be around 1.7 crores. It's a big number. So it's not just numbers that we are talking about, we are also talking about how to set up all these services when everything is not enough. The challenges faced, I just give it to you just in a short thing, is like low awareness. Why is it that we are not able to do this? Because it's a low awareness. People do not understand this. There is stigma. People do not want to talk about it. I have seen a place in the family where the alliance was did not go through because the grandfather had dementia. So that stigma is attached. People do not want to talk about mental health. There is also very few memory clinics, very few memory clinics wherein they can get an early diagnosis. And then coming to the few experts, now NIMHANS is one of the things which are brilliant experts. But how many experts are there all over the country to look into this number? And to tell you the thing is, 90% have still not been diagnosed. So you can imagine the numbers. What we are just talking is just the 10% which I am talking about. And there is dearth of services. Where can you find? Because Karnataka is full, because they understand. We have any number of daycares, we have residential care, but it's pocketed, it's not in all the states. Then the high cost of care. Let me tell you, this is the most important thing in this, because a person has to give up their work to look after this person, and all the cost is from their own pocket. I think we have to find ways and means of how to support this particular issue. So this is how we formed, in a small way we started this Dementia India Alliance, which we got together people who, and Nightingale's Medical Trust is just spearheading it, but we joined hands with like-minded people, caregivers, and NIMHANS is part of us. So this is the alliance which we are trying to see whether we could close this gap and have continuum of care too.
Dr. Radha Murthy said 1.7 crore. Is that the number? 1.7 crore is the projection. That's right. So which means that if we have 1.7 crore people who have dementia, we will need at least 3 caregivers for each person for us to be able to at least sustain ourselves and make sure that caregivers get enough support and care, because a single caregiver cannot look after a person with dementia for so long. I just want to emphasize the point 5 that our director, Dr. Pratima Murthy, mentioned, and that is about caregiver support. I think if we need to put money somewhere, we need to put our money into caregiver support. I think that's something that we really need to emphasize, because if we want the persons who are living with dementia to live in dignity, we mentioned that they cared for us, and so we have to care for them. And it's so important to give it back to them with the same kind of dignity and the same kind of love that they looked after us. I think caregiver support is very important. Just want to give you a small example of a struggle. Last week, one of my aunts who has dementia was getting aggressive. She didn't want a diaper. She was threatening her caregiver. I wanted to talk to the caregiver and explain to her how she can look after. And what was happening to my aunt, who was otherwise a very smart, independent woman, didn't want a diaper. I was looking for resources in Kannada, some short talks in Kannada or about how to manage behavior problems in people with dementia. Believe me, I did not find a single resource. I struggled, I asked all my colleagues. There were a lot of complex resources on dementia, but nothing which I can give a Kannada speaking caregiver, nurse, to say, Hig Madi, Itara Nodkoli, this is why she's having a problem, that is why she's having a problem. So I have a feeling that we really need to focus on developing local resources, simple things which may not cost too much money, but put all our money into training. A lot of our money into training caregivers. There are some people in the audience here, I know, who are nodding as I'm speaking, that it is a challenge to look after persons with dementia. Families depend on them, thinking they are trained, but they are not trained to manage so many challenges. Each person with dementia may have a hearing problem, may have a visual problem, may be frail. One person with dementia is not like the other one. Somebody is withdrawn, somebody is aggressive. I think a very good, solid training program is what is the need for the day, so that we can ensure that persons with dementia, our dear relatives, stay with the same, cared for with the same dignity that they deserve. And I would urge that the government put money into developing these locally available resources, because Karnataka is not only Bangalore. There are people from other parts of the state who will need these resources, who will not have a NIMHANS, who will not have a Victoria hospital that they can go to. So I think this actionable plan is a very important one, and the item 5, which focuses on home-based caregiver assistance and importantly resilience and education, is one of the priority areas. So
Cancer, AIDS, HIV, etc. Now from all these diseases, even from the terminal stage, patients have recovered, come back and told how difficult and how bad it was to live with that disease. But there is only one disease in the world as on today which has got no cure. No single person has recovered from it to talk about how difficult and bad it is, and that is dementia, Alzheimer's to be in particular. It's people like me who have looked after their near and dear ones. As told, I looked after my wife for about 12 years. I won't say looked after. I underwent that, what this Alzheimer's was along with her, and probably what she suffered. I can say I suffered much more than that. And that is true for every caregiver. Now, it takes very long to detect. She got at the age of 52, 18 years back, and the situation is not much better today. Even now it takes about 2 to 3 years. By the time a patient is in the advanced stage, that is the time it is detected. Why? Because people don't come out with it. Last 5 years I have given about more than 200 talks on Zoom and physical, telling people what Alzheimer's is, what are the symptoms, please accept it. Believe me, during the talk, nobody asks a question. Once almost everybody has gone, then 1 or 2% will trickle in. Sir, I think there is a case in our family. I say, why didn't you tell earlier? As Dr. Radha said, there is a taboo in our society. I ask everybody, any other disease happen, do we hide it? 2 years back, I had cancer. I think I told everybody I am suffering from cancer to get good wishes. Why to hide Alzheimer's? Now, though there is no cure, a person has to suffer. But my idea is, once early detection is there, if nothing else, the life of the patient becomes better. Because I know for about first 3 to 4 years till it was confirmed, and even after that 2 years, it took a lot of mental thing to accept that she is mentally deranged. I always used to feel angry, irritated, even raise my voice, what are you doing? What's the wrong with you? So once we know it's Alzheimer dementia, we know a stage was there in my house in 6 rooms, drawing room, bedroom, dining, kitchen, corridor. I put posters. She is not doing on purpose. Now this is what I want to appeal to everybody. Please, if there is somebody your near and dear ones, get him or her checked up. There's nothing wrong. It's a mental disease. You haven't caused it, so don't feel bad about it. It's one of those things which have to be tackled. The various problems Dr. Radha Murthy has mentioned, we in Dementia India Alliance are aware of it, and we'll take all the efforts to overcome that.
Janardhan Reddy is head of the Department of Psychiatry. Dr. Yasha is the Chief of Neuroscience. And Dr. Alladi, how many people do you have in this team from NIMHANS working